The public will become aware that there are nurses, nurse professionals, successful nurses with a great amount of experience and knowledge that will be available to them in advocating on their behalf. Issues that are important to public health, patient health, and that can be affected by occupational and environmental health hazards. I think it's when we came together and we realized that we were all had the same mind frame and the same plan, and we really wanted to do the same thing, and realized that we are one great mind.
I would say the biggest challenge for us has been perhaps finding the nexus between our different areas of nursing and the areas in which we work in hospitals, in public health, in academia. And our pursuits and our day jobs are all very different, but at the same time we have this common interest around environmental health, and finding how that links together and finding how to go forward in moving environmental health into nursing practice and advocacy around environmental health issues in the public arena together as a unified group, but with very different interests outside of environmental health or in relationship to environmental health. I think that's been one of the interesting outcomes of this conference, has been to find that we have a lot in common with one another. I don't normally see myself as having that much in common with nurses in acute care or nurses who work in hospital arenas, but in a lot of our discussions I've learned a tremendous amount of what's going on with nurses in hospitals and what their work is around environmental health, how it relates to what I do, how I can translate that into public health activities and public health information and knowledge that works for me in my arena, in teaching students and doing research and coming together around advancing environmental health in nursing, for example. What I'd like to tell to my colleagues in particular, and those would be for me a lot of nursing colleagues and people in public health, would be that environmental health has everything to do with everything we do in health. That we can't be talking about improving people's health without talking about the environment. That the environment is not a separate issue, it's not for a different specialty, that it has everything to do with all aspects of our care if we're health professionals.
The meeting's been extremely helpful to me because I'm realizing that there's a resource for our Department of the Environment and for our Department of Public Health section on the environment that I can tap in San Francisco by doing some education of nurses in the city and county, and to engage them in a lot of our environmental activities. I would like them to participate on the Commission on the Environment, to seek a seat or multiple seats on our Commission on the Environment, to point out that nurses are involved in greening the city. We pride ourselves in being the greenest city in the United States, and I think that nursing activities, and I've heard from some here that are occurring at UCSF, which is our second largest employer in the city, that nurses are doing, and I want them to take credit for that and be recognized for that. And that will help them get into positions of power and decision making in other public sectors in the city.
I've never been to an event like this before. This event is extremely unique. You've got so many great minds here thinking of a movement surrounded by environmental health. And this event is very special because people have come from all over the country to discuss the movement of environmental health and nursing. There are a lot of commonalities here. All the nurses share the same vision of incorporating environmental health within current nursing practice. And that environmental health goal is included in all varieties of nursing practice. So even if you are working on the graduate level, or practicing as a bedside nurse, or working within local or federal governments, the vision is still the same. I believe that all the people here have something very special to offer, and it does not matter what your credentials are behind your name. It's that you are here contributing and fully present and offering something to the profession of nursing and environmental health. I'm going to have a lot to share with my fellow nurses when I go back home. First of all, I'm going to be able to share what's come out of this meeting with bedside nurses as well as my fellow students. And I'm going to share with them some of the ideas that we've discussed, such as incorporating environmental health within current practice and not creating a subspecialty. Also going to talk about the importance of creating an e-commons, a common workplace where we can come and share information. And also want to bring back some inspiration to all those nurses that have a lot of questions about environmental health nursing. I'm going to be able to give them direction as to where to go.
No, it's a National Association of Neonatal Nurses. So I'm here on behalf of all of the neonatal nurses that are here in the United States who are members of that national organization. Well, I wouldn't say I'm not an environmental nurse, because one of the most important things I've learned is that every nurse is an environmental nurse. Well, I think what's important to me to take back to the organization I'm here representing is that we need to increase the awareness to all of our neonatal nurses that environmental health issues impact not only us as professionals, but also the babies we take care of and their families. Environmental health does have something to do with babies. It's not just about thinking about the water and the air. It's about the health of all of us. Well, these people in this room at this meeting are doing amazing things for everyone. They are really trying to advance the information, the science behind environmental health, behind the environmental risks, trying to educate all nurses to the issues and really to the science that's really come and brought us to this point. They're really helping nurses in every profession and in every discipline to be advocates and to really understand the real current urgency of the information. Oh gosh. Neonatal nurses, we need to learn more about this, and being here with these people who have, and people I say, but professionals who have been really already such experts in this field. I think what they can take from us is our passion for our small patients and for the patients and their families that we're caring for every day. Absolutely, I think neonatal nurses are environmental nurses.